Hi guys, so still on the Rcgp Sca sample cases. From the case on the petechial rash, remember I forgot to mention the third criteria where you need to be considering reducing the dose of apixaban from 5 mg twice a day down to 2.5 mg twice a day. So the third criterion is if the patient's body weight is less than 60 kg. Okay, so less than 60 kg body weight, you need to be dropping your apixaban dose. If the serum creatinine level is above 133 micromole per liter, or the patient's age is more than 80 years, these are criteria that you will need to be thinking, oh yeah, we need to probably be dropping the dose of apixaban. So let's move on to, this is the sample case 5 on the website. If you go onto the Rcgp website, this is the sample case number 5. And this is on Alice Brenner. And we're going to be talking about results and skin. Instructions to candidates. Patient's name Alice Brenner, age 20 years. Alice was seen 5 weeks ago by another GP who wrote notes as below: oligomenorrhea, acne, no hirsutism, blood pressure of 122/65, non-smoker, alcohol 6 units per week, BMI 21. Issued DWAC gel to be used at night. And the plan 5 weeks ago was for Alice to have some bloods and ultrasound of her pelvis. So last week, Alice had an ultrasound scan of her pelvis that showed multiple small cysts on both ovaries, consistent with polycystic ovaries, otherwise a normal pelvic scan. 1 month ago, Alice had her blood tests and the results are as follows: LH, FSH, testosterone, prolactin, sex hormone binding globulin, thyroid function tests were all normal. So her testosterone was normal. LH, FSH were normal. So prolactin, everything was fine. All her hormones were normal. But her ovary is showing polycystic ovary. She has oligomenorrhea and she has acne. With normal hormonal bloods, are we going to still make the diagnosis of polycystic ovary syndrome? Yes, we will. She's having oligomenorrhea and radiological evidence of polycystic ovary. So yes, we can confidently make that diagnosis of polycystic ovary or polycystic ovarian syndrome. Questions for discussion and notes. Is there any helpful information in the case notes before starting the consultation? Definitely. 5 weeks ago, over a month ago, she saw your colleague and she had acne, she had oligomenorrhea, she had normal non-smoker, normal alcohol consumption. She was started on DWAC. So it's very important to know that she was started on a DWAC for the acne. So in this case, in this follow-up visit, you need to be finding out, oh, I can see my colleague prescribed you a cream to use for your spots. How has that been? Have you noticed any improvement so far? You need to be following up on that. In addition to, of course, saying, I can see you had some blood tests. I can see you also had a scan of your pelvis. Has anyone discussed the results of these, investigations with you? And then checking, just so we can interpret these results in the right context. Could you tell me, a little bit more as to why you saw my colleague in the first place? I know I've got your notes, but I just want to hear from you again. Why? What brought you to see my colleague in the first place, and what are you understanding about these tests that were requested? Just for you to get some data gathering, information. How might you effectively explain these results and check understanding? So you need to be explaining that exactly what you said. My colleague was thinking there could be problems, something to do with your hormones. and that's why you're having these, more scanty periods and the spots on your face. That the good thing is that your hormone levels were all normal. However, the scan you've done confirms the presence of really small grape-like cysts in your ovaries. And this is what we call polycystic ovarian syndrome. Is this something you've heard about before? Patient might say, oh yeah, I've read about it. Okay, could you tell me what you understand? Or is this something you've heard? Is this something, are you happy for us to talk about this today? Is this something you want us to, are you happy for us to, are you happy for me to explain in more detail what this entails? And then the patient will say, oh yes. Then you discuss, explain, and then check understanding. From everything I've said, just to be sure you've understood me clearly, are you able to repeat back to me, what you've understood from what I've said? So that's checking understanding. Given she has polycystic ovarian syndrome, what management options should you consider, including acne treatment, contraception, cardiovascular risk, etc.? What might you advise her about self-care? So in terms of acne treatment, we need to find out if the DUAC cream is helping. We need to be advising her that if it's not helping, there are other options we can try. So the DUAC contains, benzoyl peroxide and clindamycin. So which means it contains benzoyl and an antibiotic. So at that point, we can say, okay, if it's not working, maybe we should try benzoyl peroxide and adapalene, which is epiduo, or benzoyl peroxide alone, and combine it with an oral clindamycin or oral doxycycline, or the limecycline, for instance, oral antibiotics and topical benzoyl peroxide. Or we could even do epiduo, which is adapalene, topical adapalene plus benzoyl peroxide in addition to an oral antibiotic. So giving that option, and also telling her that sometimes an option, a very reasonable option to try for your spots as well, is what we call the combined hormonal contraceptives. But you have to check, does she really want contraception? If she's trying to have a child, for instance, you shouldn't be starting her on a contraceptive pill to help treat her acne. At this point, I'm suspecting polycystic ovary syndrome. Does it come with an increased risk of stroke? I know it can come with a slightly increased risk of ovarian cancer, but in terms of stroke, cardiovascular risk, I need to double check that. I'm not very sure, to be honest, but I suspect there's something about polycystic ovary and slightly increased cardiovascular risk, but I'll need to double check that. What might you advise her about self-care? So for her acne, she should wash her face, clean her face, but she should avoid overwashing. She should avoid keeping her face, allowing her face to be dry. At the same time, usually it's advised not to allow her face to be oily as well. So choosing the right self-care creams or lotions is very important. You advise her to use emollients to soothe her skin, in addition to carrying on with the recommended treatments that you're advising, which it could be epiduo, in addition to oral limecycline, for instance, or doxycycline, or erythromycin. These are commonly prescribed oral antibiotics. So we could be trying that. She should avoid fragranced soaps, fragrance, lotions, because sometimes they could also worsen her spots, her acne spots. She should avoid trying to squeeze the acne because it can lead to scarring. Okay, it can lead to further inflammation and scarring. You need to be safety netting. If you begin to notice scars, come back to me, because at that point we might need to refer you to the skin specialist for further treatment, which would then be isotretinoin tablets, typically. How might you discuss the possible impact on fertility? You need to discuss that a lot of people, that polycystic ovary sometimes could cause problems with fertility. However, we found that so many people with this condition carry on, having no significant troubles conceiving. However, it's something we need to mention to you. If you get to the point where you decide to have a child and you find that you're struggling, or advise you come back to us, and there are ways we can help. We can always consider referring you to this fertility clinic, and there are lots of ways they can help to ensure that conception wouldn't be a problem for you. So reassuring her that there are available services, there are available treatments if she ever finds herself struggling to conceive. Also telling her that a lot of people with polycystic ovary will normally go on to conceive, without having any problems with fertility. It's very important you let her know that, because that's actually the truth. Are there cues about how she's feeling? So you need to say, I can sense you feel down with everything that is going on. Is this the result you were expecting, or were you hoping for something else? And then you watch. How have you been feeling? How has your mood been? How have things been? Is there any particular stresses going on in your life at this point? Check. Are you in a relationship? How are things with your partner? You know what I mean? You need to think broadly. Is there domestic abuse? Is there verbal abuse? Are they trying to have a child? And they're struggling? Is there a strain on their relationship? You know what I mean? So you need to explore, think broadly. Are there cues about how she's feeling, about her skin, and her life in general? How might you respond? Oh, I'm really sorry to hear that you're struggling this much. It's really good you've come to meet me today so we can talk about ways we could help you. Show empathy, demonstrate empathy. The purpose of this case is to explain results and a new diagnosis of polycystic ovary syndrome sensitively and effectively to a young woman who has concerns about her skin and possible future fertility. There may be a considerable amount of information to be shared. This should be balanced with responsiveness to her cues and priorities. For instance, if she's not thinking about getting pregnant, if pregnancy is not on her plans in the next 10 years, you know what I mean? If her skin is the most important, if she's a model, or she's more important with treating the acne, if that's her priority for now, she might tell you, doctor, you know what, fertility is not really a problem for me now. My major issue is the sports. It's making me depressed. I just can't, I've lost my confidence. Is the sports now my main issue? Then you need to tell her, brilliant, we can help you with these. There's so many things we could try. A lot of the time it's hit and miss until we get the right treatment for you. So we might find that we'll try several combination of several treatments until we find the right treatment for you. Is there any particular treatment you were hoping I'll be, prescribing for you today? Is there something you have read or you've heard about that you think you want to try? Explore her mind. Okay. You see, how have you felt? What's the impact of the sports? What impact is this sports or this acne having on you? She might tell you, oh, she has to put heavy makeup, and another important thing is that she needs to wash off her makeup completely every day before going to bed. So she should always wash off her makeup completely. Avoid using fragranced cosmetic products and fragrance lotions. Very important. So we've come to the end of this particular sample case by Rcgp. Wish all of you success in your exam. Cheers.